Good afternoon. My name is Jay. This is my presentation. Today's lecture is on meniscus tears, specifically with surgical intervention in a lacrosse player at the collegiate level. This is our athlete. His name is Elijah Brooks. He is 20 years old, and he plays in the NCAA Division I at Lazost University. He's a midfielder, plays lacrosse. As you can see, there's a lot of information on this slide. I know it's overwhelming, but it's kind of interesting though. A good thing to keep in mind when you're working with a patient, they are very much more than just an injury. So, working with an athlete is very different from working with a non-athlete in multiple ways. Athletes are very coachable. They want to get back on the field. They have these big goals. They've worked hard for so long, and then they get injured, and it is devastating. And all they want to do is get back on the field, which can make them really cooperative. They can work with you really well. They coach really well. So let's get into meniscus tears. Meniscus between your tibia and your femur. It is the cartilage that sits between them. It absorbs all that shock from you running, jumping. It distributes the weight evenly. It helps kind of make that nice and smooth when you're moving. As you can see in these images down here, we have a kind of animated image so you can see where those cartilaginous rings are between those two bones. Down the bottom here, you can see kind of an MRI image of the two different rings. They are not symmetrical, they are two different sizes. Another big thing to keep in mind, and this will come into play later on as well, the outer 1/3 of this kind of ring right here is vascular. That there's a lot of blood flow in there, healing happens. So if you get a tear in there, it's easier to heal because you have that oxygen and all the nutrients and everything. The outer or the inner 2/3, there's no blood flow. It's avascular, meaning you're not going to get any healing. So let's get into types of tears. Longitudinal, I have some images coming up later on as well. Longitudinal kind of runs lengthwise along the outer rings. Bucket handle is also a different type of longitudinal tear, but can also block the knee because it'll kind of flap up. So it's like a bucket handle. Flap can cause that kind of catching or locking in the joint. A radial tear is going to be from in to out or the other way around. And then complex or degenerative, it can be a combination or also kind of just degeneration over time. So here you can kind of see there's an MRI image here, and then there's also a kind of a animated image. You can see that longitudinal is like along the ring versus the radial tear, which is kind of against it. Bucket handle, here you can see that kind of longer longitudinal tear that can flap up and cause a lot of issues. And here we see a very classic flap tear. So, diagnosing a meniscus tear. When you're diagnosing an injury of any kind, you obviously do a lot of special tests. I'm sure you all know. You've been through many special tests and trying to memorize all of them. McMurray's, Apley's, and Thessaly's are the big three when it comes to diagnosing a meniscus tear. So McMurray's and Apley's are different from Thessaly's in that PT is going to be doing the movements. So McMurray's, as we all know, kind of figuring out that motion. You're going to try and create that grinding sensation to try and see if there's any pain, any catching or anything. Apley's is kind of the same thing, adding that force. Thessaly's, you're using the patient's body weight to determine or to kind of recreate that motion, which is going to be the most accurate. Thessaly's is going to be the best one. So you have the patient kind of standing on that one leg. Obviously, you start with the uninjured side first, but Thessaly's, you start by standing on one leg. You're going to kind of hold on to the patient's hands. You can have them kind of hold onto a bar or something. Hands probably better because you can kind of help them rotate. But you want to have them stand on one leg. You're going to rotate side to side. Thessaly's, you also do in two different ways. You do it open pack and closed pack. So open pack, you're going to be standing with your legs straight. That's when it's going to be the most stable in that joint. So you're not going to get as much movement, even if you kind of rotate a lot on there. If you bend your knee, however, that's when the joint is at its loosest because it's in closed pack position. So that's going to kind of give you a more accurate result. Surgical techniques. There's different kinds. Repairing, probably more common, just because you stitch it back together. If there's a tear, you stitch it back together. Um, Meniscectomy. This is what our patient has as well. Removing the damaged portion or the entire meniscus. So I kind of mentioned this earlier with the flaps. You kind of shave down the flaps. That's pretty common, especially with the inner part, the avascular. And then you can also do a replacement. This is not as common because it's intense. So that's usually considered for younger, very active patients with really severe meniscus damage. So let's look at the general rehab process. Phase one. I know we've gone over this a lot, but phase one, 2 to 6 weeks, really what you're just trying to get back is that range of motion, especially knee flexion when it comes to meniscus. You want to get that knee flexion back, and then just kind of starting to work on beginning strengthening exercises, working on the quads, the hamstring, hips, etc. All right, phase two, 6 to 12 weeks post repair. We're just kind of working on the strength now. Our range of motion is back, so we're working on strength and endurance as well as total patient. Now we can start adding a bit of resistance. We can start adding weight depending on tolerance, how the patient is doing. Phase three, 12 to 14 weeks. Now we're getting into kind of the more ABCs, stability, agility. We're working on the neuromuscular control. So phase four. Now this is where we're at, and we're going to go over some videos. 14 weeks and onward, post repair. We're getting into the functional and the sport specific exercises. So now we're really taking lacrosse into consideration. Lacrosse, we should also be taking into consideration on the other phases as well, but specifically phase four. So, back to Elijah specifically. Mechanism of injury. Very, very common for a meniscus tear. Twisting, planting, changing direction. Very common. So we want to work on kind of targeting that movement. Here are the exercises. So the first one's going to be a med ball rebounder drill. There's a few ways to do this. I'm sure a lot of you know med ball slams. Grab the ball, overhead throw, down to the ground. There's a lot of different ways you can do a med ball toss. You can do to a wall, etc. This is very much a core exercise. It's throwing, etc. So you're going to hold the medicine ball up, slam, down on the ground. Another way we can do this to kind of really work on that planting, the twisting on the knee, as you kind of saw in that Thessaly, we're kind of going to recreate that Thessaly motion. So, our lovely demonstrator, Andrew. Andrew's going to show us this drill. It's kind of an interesting one. You can see we have this little trampoline right here. It's a mini trampoline. It's called a rebounder, a plyometric rebounder. It's pretty cool. He's holding here a med ball. As you can see, he's standing on that one leg. So we're kind of recreating that Thessaly motion. He's going to do a lateral med ball slam, but he's going to do it down on the trampoline instead of the ground. So it kind of bounces at him again, so he has to catch it. So we're working on balance because it's single leg, twisting, and that kind of core throwing. So I will play that now. Next one we've got is a four corners cone drill. This, you can do a lot of different variations of it. This is what I have on here for that specific kind of changing directions. So that was kind of twisting, recreating that Thessaly. Now we're going to do changing directions. He's going to sprint forward to the orange, lateral shuffle to the red, backward shuffle to the yellow, and then lateral shuffle the other direction to the blue. So then he has to switch directions. So he doesn't know when I'm going to call out switch. So he can't anticipate that to kind of prepare his knees to change that direction. Single leg hops and mini hurdle drills. There's a lot of progressions you can do with this as well. Then you can do kind of what you'll see in the video, a square, small square. We have little dots that we did. They're a little slippery. Beware. If you have tape, probably a better choice. You're going to hop back and forth on the little square. This is going to kind of put a little bit more force on it. You're going to put a little more changing directions. Another way you can progress this drill is over mini hurdles. Andrew here is going to pause between every jump. So he's going to jump, reset, jump, reset, jump, reset. Yeah, okay. Class dismissed.